Body of leukemia is my presentation. First of all, what is leukemia? It affects the body's ability to make blood cells. It originates in the bone marrow of long bones. The bone marrow is where blood cells are made for the body. And blood cells include red blood cells, white blood cells, and platelets. The red blood cells take oxygen from the lungs and bring them to the cells. And then they take the CO2 from the cells back to the lungs where we breathe it out. White blood cells, they assist the body in our defense system, and platelets help clot the blood. And leukemia is mostly focused on red blood cells. And then to the right, we can see an original stem cell, and that can split into a myeloid or lymphoid stem cell, and they both go down to all of these cells in our blood. Next, we have the causes of leukemia. We have exposure to radiation and chemicals such as benzene, which is found in unbreathed gas, along with other hydrocarbons. Exposure to agents used to cure or control other cancers, including radiation. So if you have cancer and they're treating it, one of the side effects of the treatment is actually leukemia. And then certain genetic abnormalities such as Down syndrome can actually account for leukemia. And then to the left, we have some other causes such as infections, chemical exposure, genetic conditions, your race, and whether you smoke or not. The affected white blood cells. So there's two main types of blood cells. White blood cells, there's granulocytes and agranulocytes. And then lymphocytes is a type of agranulocyte, and that accounts for 25 to 32% of white blood cells. And then from those lymphocytes, you have T cells and B cells. The T cells are increased during viral infections and when tumors are present. And then B cells are primarily responsible for producing antibodies against foreign substances which are found inside the body. And then granulocytes, this includes neutrophils, eosinophils, and basophils, and they account for 55 to 66% of total white blood cells. The neutrophils are responsible for phagocytosis, which is eating and destroying any foreign body found inside the body. Eosinophils kill parasites that are within the body, and basophils release heparin, which is a blood thinner. So there's acute leukemia and chronic leukemia. For acute, it is when immature white blood cells multiply quickly in the bone marrow, and as this multiplication continues, they crowd out healthy, mature white blood cells. And then in acute lymphocytic leukemia, this is most common in children under 10 years old. It occurs when blood-forming cells called lymphoblasts reproduce without developing into the normal blood cells, and they can collect in the lymph nodes and cause swelling. In acute myeloid leukemia, this occurs when blood-forming cells called myeloblasts reproduce without developing into normal blood cells. Immature myeloblasts crowd in the bone marrow and interfere with the production of normal blood cells. This is when the cancerous cells kind of crowd out the good cells. And this leads to anemia, a condition in which a person does not have enough red blood cells. And then we have chronic leukemia. This is when the body produces too many blood cells that are only partially developed. These cells often cannot function like mature blood cells, and this develops more slowly and is less traumatic than acute leukemia. Acute leukemia is more suddenly onset. Chronic leukemia, people can actually live with it for many years without even knowing they have it. And then in chronic lymphocytic leukemia, we have abnormal lymphocytes cannot fight infection as well as normal cells can. So they live in the bone marrow, blood, spleen, and lymph nodes. People with This can live a long time even without treatment, like I said, and it is usually discovered when a person has a routine blood test that shows elevated level of leukocytes. And then chronic myeloid leukemia, this is when abnormal cells, uh, the abnormal cells are a type of blood cell called myeloid cells. And this usually involves an affected string of DNA called the Philadelphia chromosome, and the genetic defect results in the production of an abnormal protein in the cell, and drugs can usually block the function of this abnormal protein, improving a person's blood counts. Some cases of this can be actually cured by a bone marrow transplant if the original drug does not work. Then, how do you diagnose it? So, a doctor, upon his physical examination, will find swollen lymph nodes and a large liver or spleen. And then he will do a bone marrow biopsy, and he will take a piece of bone marrow and look at it under the microscope, and he can actually see if you have any abnormal white blood cells. And then more blood testing to see what cells are actually abnormal. And then genetic testing can account for the Philadelphia chromosome. And to the right, we have more ways the doctor can diagnose you, such as a lumbar puncture, a complete blood count known as a CBC. And then treatment, there's three basic steps once you get diagnosed with leukemia. Step one is induction. This gets the cancer under control using chemo, so no more leukemia cells are found in the bone marrow. And the goal is to get into remission. And remission does not mean you're cured. It just means that there's no more cancer cells within the place that they're in. And step two is consolidation. This is another short round of high intensity chemo, and this is just to make sure the cancer doesn't come back, so you don't relapse in the future. And then step three is maintenance. This is a longer 2-year chemo program that is designed to reduce the chance of recurrence. Because 2 years is so long, chemo is usually not as high intensity as in step two. And then immunotherapy is another way to treat this cancer. It uses a part of a person's own immune system in order to kill the cancer cells. This can stimulate the natural defense of the immune system so it works harder and smarter to find and attack the cancer cells within the body. And it can, in making substances in the lab that are nearly identical to your own immune system components, and it uses them to help restore or improve how your immune system works to find and attack the cancer cells. So here we have a prognosis. In the bottom left, this shows the 5-year survival rate, and it's relatively high in all of them, except for the acute myeloid leukemia. It's really good in the chronic, because most people don't even know they have it, and it's not that big of a deal. Once you find it, it's relatively easy to treat. And you can see the death toll is highest among the elderly. So even the children who get it, the ALL and the under 10, they are usually cured relatively fast. In the upper left, we have the reoccurrence rate. So in the ALL, it's 15 to 20, and in the acute myeloid, it's 9 to 29. And then on the right, we have the survival rate, and again, the younger you are when you get it, the better chance you have to survive. And then from the medical journal, treating relapsed childhood acute lymphocytic leukemia, mostly the same elements of chemo with different combinations of the drug. Remission can be achieved in more than 70% of early relapses and up to 96% of late relapses. And currently, approximately 80 to 85% of children with acute lymphoblastic leukemia can be cured, like I said. And the most common cause of treatment failure in pediatric leukemia is relapse, and it occurs in approximately 15 to 20% of patients.